But one of the things that we especially worry about, especially at where time is essence, is heart attacks and chest pain, right? So chest pain, chest discomfort, chest pressure, shortness of breath, especially acute onset of shortness of breath, passing out, so losing consciousness. Again, losing consciousness could be dehydration, but it could be an arrhythmia, it could be a heart condition. Swelling in the legs, that could be a sign of heart failure. It could be a sign that you just have venous disease, but it could also be a sign of heart failure. So anything that is out of the ordinary, sudden symptoms, you have to get urgent or emergency care. Chronic symptoms, again, you may follow up with your GP, who may have a history and be able to do some initial investigations before they then go ahead and either refer you or manage whatever symptoms it is. But in terms of heart attacks, strokes, those are acute conditions that require emergency treatment. So any loss of function, loss of speech, loss of strength, sudden loss of strength, those are all signs of strokes. And then the signs of heart attack, as I mentioned, sudden onset of crushing, chest pain. Women may present differently than men when it comes to heart attack symptoms. So if you're feeling something that is out of the ordinary, then you need to present. For some, it may be as simple as fatigue, So again, you should, know your body, but also know when something feels different. Because time is muscle.
Yeah.
So we didn't get into the specific cardiovascular diseases, but the concern is, and a lot of people, again, think they're just having heartburn. If the artery gets clogged because of atherosclerosis, which is plaque, we talked about heart disease being a disease process where the vessels can get clogged up due to high blood pressure, diabetes, all those things. But that plaque that forms in your arteries can then rupture and cause a clot to form, and then you don't get blood flow. So blood flow ceases. If blood does not reach an organ, that organ is going to die. And that's what a heart attack is. So if they do not get you in within 90 minutes, we say 90 minutes to 6 hours, 90 minutes is the golden time to open up that artery. That muscle is going to die and it's not going to recover. And that's how people develop heart failure, because of one of the causes of heart failure, among other things, is when that muscle dies, the heart goes from pumping at normal 60 to 65% to pumping at 30 or even 20 or even 10, 15%, because that muscle is now gone. So certain conditions, same thing with a stroke. If you cannot open up that artery, then that muscle in the brain dies. If you get acute care and they can open up that artery within a period of time, you can get complete recovery and heal completely. So that's why we take chest pain very seriously.